There are so many visual problems that are common with children, but the most common ones are strabismus and amblyopia. At the end of this video, you should be able to know the visual problems that are common with children, signs that will indicate that there is a problem, and also steps to take to make sure that your child's sight is not damaged. Please don't go anywhere, stick around. If you're looking at raising a total child, then this channel is for you. My name is Dr. Chinyere DC. I'm an optometrist, a mom of 2, and the founder of Parenting on the Go. If this is your first time of watching my video, please hit that subscribe button so you get content like this and also some parenting tips. And if you're already subscribed, I appreciate you. Don't forget to hit the notification bell so you get notified each time I upload a new video. So the first visual problem we're looking at is strabismus, which is the misalignment of the eye. Sometimes you notice that the child's eyes are either turned in or out, as the case may be. Does your newborn sometimes look crossed-eyed? This is not a problem because at birth, the eyes are not fully developed, but as they grow, the eyes begin to correct and become normal. But if after 4 months you discover that your baby's eyes are still not aligned, they are still looking crossed, seriously crossed, then that calls for concern. You should take your baby to see an eye doctor. Sometimes parents come to the clinic and complain about taking a picture of their baby and then the baby's eyes are not looking straight. That's not a problem, but if it persists after a long time, then it is abnormal and then you should take precaution. If the eyes are seriously misaligned, it could lead to amblyopia, which is also known as lazy eye. That's the next thing we'll be looking at. But if amblyopia is treated on time, vision may not be lost in that eye. So strabismus is not really a big problem if it is taken care of early. There are ways that strabismus are handled. It's either you patch the good eye to force the eye that is wandering around to begin to walk, or there are specific eye drops that you can use, or even surgery. So you need to get your child to an eye doctor on time to avoid your child developing amblyopia. Amblyopia, also known as lazy eye, occur when there's poor vision in one eye. It is as a result of crossed eye, which is strabismus, and difference in refractive error. If you haven't seen my previous video on signs that indicate your child needs to see an eye doctor, you should see that video. Amblyopia has no warning signs because your child will not be able to report what is going on in their eye. So visual screening is the only way of detecting amblyopia on time. I know sometimes you'll be wondering, how can this be done? There are many ways that you can check your baby's eyes even if they can't talk or read. If amblyopia is left untreated, it could lead to irreversible loss of vision in the affected eye because the brain's programming starts ignoring signal coming from that eye. So the best way to treat amblyopia is early detection. So you need to get your child to see an eye doctor as soon as possible if you have any doubt or any concern. The next visual problem we'll be looking at is nystagmus. When you notice that your child cannot make a steady movement, there's excessive movement of the eye and they cannot see properly, your child may have nystagmus, and it's very common in the albinos, so you should see a doctor. Another visual problem is retinopathy of prematurity. This is a visual problem that usually occurs in premature babies. So make sure you do a proper visual screening for your baby if they are born premature to be able to rule out this condition. Another visual problem is retinoblastoma. you have to find out if there is a family history of any malignant tumor, and this usually occur in the first 3 years of life. The affected eye may have visual loss, and also there will be whiteness of the dark parts of the eye. Another visual problem is infantile cataract. Infantile cataract occurs in newborn babies. Cataract is the clouding of the lens. So if you notice that your baby is born with a white part, where the dark part of the eye is looking white, then your baby may have infantile cataract. So the next visual problem we'll be looking at is congenital glaucoma. It is rare, but it is inherited. So if there is a family history of glaucoma in your family, you want to do a glaucoma screening for your baby to be sure that your child does not have glaucoma. It is as a result of high pressures in the eye due to incorrect or incomplete development of the drainage canal that drains tears from the eye before birth. So you notice that your baby is always tearing. This can be treated with medications or surgery. I hope you found this video really helpful. Don't forget to share, like, and also hit that subscribe button. Turn on your post notifications so you get content like this each time I upload. Follow us on all our social media platforms. The links are in the description below.